Hey guys, it's your girl Bianca, and I am coming back to you with another book review. Today we are talking about Do No Harm by Henry Marsh. This is a very interesting book because Henry Marsh, the author, is a neurosurgeon and he tells accounts of his time as a surgeon and as an outpatient clinician, as well as a volunteer surgeon in different countries. And he really opens up about how hard it really is to both be a professional clinician who has their patients' lives quite physically sometimes right within his hands, and also being a human and even being a patient himself. Um, Dr. Marsh talks about the mind brain problem. The mind or the brain is made up of neurons and physical matter. But when you think about the depth of the human mind and the consciousness and our personalities and everything that really makes us up, not just the biological processes that make us up, but our subconscious, our deep thoughts, our memories is all physically in there, you know. It's thousands, millions of cells communicating with each other. And the mind brain problem brings up a philosophical component as well as a neuroscience component, where physically we are dealing with cells that can be manipulated or damaged via surgery. And, metaphorically, philosophically, we are dealing with a brain that has consciousness of who they are, has consciousness of the now, has consciousness of the past, can perceive the future, can perceive the concept of being a self. Um, it just really gets interesting. I found this book both sad and humanizing in a way, because sometimes we see our medical doctors as these figures who are way beyond us, and sometimes we put our lives in their hands without really understanding that they are, fallible creatures as well. They mess up, they make mistakes. There's periods of times when they have to train, just like we have to train. And, the unfortunate nature of it, and he brings it up in his book, that a good surgeon is not necessarily born, they're made with practice. And, you know, if any of you have had a surgery in the past, you know that there are tons of risks that come with surgery, some or most including death. Um, but, with neurosurgery, he has so little room for degree of error, because one little nip of an artery, one little um, overconsumption of a tumor, because he makes note that tumors, when he removes them, often look like brain matter, can just result in such a catastrophic presentation for the patient. So, for example, if the patient was relatively normal and walking independent with no device before, and then he nicks something in, let's say, the brainstem, that patient can become comatose, because the brain depends on the brainstem to keep it alert and alive. Similarly, if there's a tumor in the right hemisphere in a certain part of the brain, and the surgeon damages a part of the right hemisphere, the patient can have left hemiparesis, or lack of um, volitional movement on their left side. It really is an amazing, scary profession that I feel like is not really talked about in normal life. And so I really think that this book is a good book for not only clinicians like myself, because I do work in the health field, but also just as a person, as a consumer of healthcare. And if you are in healthcare, I really do suggest this book. I feel like it brings up um, great points of how to humanize the clinician patient experience, how to choose your words correctly. You are always honest with the patient, but you don't phrase things in ways that would put them into like a compromising position. So, for example, if you're talking to a caretaker and you want to tell them the prognosis of the patient and whether or not they should go with surgery, you have to phrase it in a more neutral way. You can't phrase it in a way where they feel like they have to do something. They have to make one choice versus the other. You have to be, as a clinician, you have to be as transparent as you can with the likelihood of survival, the likelihood of them maintaining the quality of life, um, and creating an art of not only saving people's lives via surgery, but also treating them like a human being before and after surgery. You know, the book talks about the dehumanization of a person when they become a patient because, you know, they're stripped of their clothes, of things that make them unique, and they're put in these hospital gowns. And, you know, in the case of brain surgery, they're shaven. Sometimes their whole head is shaved. And you know, Dr. Marsh said to a colleague once that he doesn't really touch his patients, you know, like before or even after the surgery. And really, like during the surgery, he's just touching their head, their brain, the parts of them that that he needs to touch, that he has to touch, but not in a like evaluative, prolonged way. I think that this book was a fantastic read. I really don't have anything bad to say about it. You know, it's 200 something pages, but honestly, I read this within a week and I would read it again if it was my book. But I did borrow this from my friends, so I'm going to give it back. But anyway, guys, I just wanted to quickly tell you about this interesting book that I read. It is not my normal book that I usually read. I usually read magic books and fiction books, but every now and again, you need to have a little bit of nonfiction in there. And I really, really like this book. So check out Do No Harm by Henry Marsh. What did you think about the binding problem, which is the concept of how we as humans we can look at an object, for example, see the colors, the shape of it, um, register the smell and maybe even the taste of it, and then formulate so many different processes about it. So, for example, a cake is not just a cake; it could be your favorite cake. It could be a cake that your grandma made for you when you were younger. It can dredge up memories, and we attach so many things to just shapes, colors, and inanimate things, and even to each other that we bind meaning to them when really they are just the object, they are just the shape, they are just the color. So I feel like the book brings a lot of different questions. But anyway, if you got any of that from this book, or if you're interested in the book and then you come back to this video, please leave a comment, leave a like, stay cool, keep reading, keep learning, keep being awesome, guys. Bye.